When a woman gets pregnant, one of the first questions she asks is, what will my delivery be like?
What will my birth plan be?
Where will I deliver?
The truth is, there is so much you don't control during labor. You want to know that you'll have the safety, support, and time to be a part of making decisions no matter what happens.
So many complications can occur and it can happen to anybody. Somebody that's completely uncomplicated or somebody that has a running list of problems.
It is reasonable to ask for transparency surrounding nurse staffing standards during labor.
There are clear nationally accredited standards for nursing care in birthing hospitals, known as AWHONN.
They lay out evidence-based ratios that support nurses' ability to practice to full scope and for birthing women to be a part of making decisions.
If you end up being induced, like so many women are, and you are on Pitocin or magnesium or dealing with other complications, AWHONN says you should be your nurse's only patient. If you're unmedicated and your baby's starting to have decelerations, we might need to look into getting an epidural.
If you're in active labor, you should be your nurse's only patient. In that immediate postpartum phase, you should be your nurse's only patient.
West Penn is the only hospital in our area aimed at staffing to meet AWHONN standards. These standards dictate what the nurse's ratio to patients should be to meet the needs of the patient. Mothers have numerous comorbidities and need more time and attention from the nurse. Being able to be one-to-one with these patients saves lives. It impacts their health and well-being. AWHONN standards should be at every hospital across the region because that's what the evidence-based practice shows.
We are determined to work with UPMC to bring the same one-to-one birthing standards to the rest of the women in Pittsburgh.
Everybody deserves good health care. Everybody deserves to feel safe and cared for when they come into the hospital.
I want to make sure that every mom in this community is getting the best care and that they are well supported when they need it most.
I want to change maternal health in Pittsburgh. I want to change our newborn health in Pittsburgh. I want to have the time to provide patients with proper education going into this new phase of life, and AWHONN helps us do that.
Pittsburgh families deserve evidence-based care.
Help us elevate women and family health in Pittsburgh. Share your input at elevatingpghhealth.org.